I'm Dr. Paul Petrangero, and I'd like to announce our new practice initiative, Metal-Free Implants. You know, in the 30 years that I've been doing dental implant procedures, rarely has a new product come into our field that's allowed us as practitioners to deliver patients holistic type results, but also with huge benefits towards the biological and the well-being of our patients. Conventionally, dental implants are titanium, and I have placed over 20,000 titanium dental implants in my surgical experience. We've also been very involved in new technologies that come out to the practice, and I've been on the cutting edge of many of these new technologies. Whether it's stem cell treatment, platelet-rich plasma enhancement, more minimally invasive surgical protocols to deliver dental implants, and shortening of treatment times for patients having dental implants. But the aspect of incorporating a zirconia dental implant into a treatment plan for patients is one of the most wonderful things I've ever experienced in my 30 years of practicing dental implants. You know, as the owner of Start Smiling Dental Implant Centers, we pride ourselves on delivering not only the finest surgical care with shortened treatment times and minimally invasive surgical protocols, but also the ultimate in treatment protocols in delivery of products to patients. Zirconia dental implants are changing my practice and the way I deliver implants to patients. You know, not a day goes on that a patient doesn't request information about non-metal implant options. And this is growing in our practice and is growing in our entire field. Titanium dental implants are very successful long-term. And titanium as an implantable material is actually very good and the bone loves it. The problem with titanium is it's very soft. So to make titanium harder so it can withstand the forces of a patient's bite, whether it's straight up and down or lateral movements, the implant companies have to add alloys to make that titanium harder. And this is where a lot of the problems come in. Zirconia is a base material that has very good affinity for the bone and soft tissues, but also does not allow bacterial plaque or tartar to form on it at the rate that titanium does. This is a huge problem because in our field, dental implant field, we have issues with people losing dental implants by developing implants that have infections. So when a patient has a natural tooth that develops a gum infection, we call this either gingivitis, which is the beginning of it, or periodontitis, which is the breakdown of the tissue and bone and patients lose their teeth prematurely. Well, one of the things our field made a big mistake on is they were teaching all kinds of protocols and making changes and advancements to dental implant materials. They didn't pay attention to a lot of the way the protocols of titanium dental implants are being placed. So in our field, we have a big problem now with something called periimplantitis, which is breakdown or diseases of the gum and bone around a dental implant. Now, I've written 4 different clinical papers on how to resolve that, but the base of that problem comes down to bacterial biofilm, which is a coating of the bacteria that forms around the implant surface and causes bone loss to occur and eventually possible implant loss or premature implant loss. Zirconia dental implants as a material does not have that biofilm formation anywhere close to the rate that titanium does. That is a huge, huge benefit for patients. Now, there's also other benefits. As a patient, you may have had a dental implant or you've had a crown, where at the gum line you see a dark color, okay? That's most likely related to the metal that's in the either implant or the crown material itself. With titanium implants, this is a problem. Now with zirconia implants, because of the color of the material, which is white, and because of the translucency of the gum tissue, that can be something that's a big concern, especially in the front of the mouth where the implants are being done. This is another huge benefit with zirconia as an implantable material. And also the holistic benefits of having no metal in the mouth or in the gum tissue in the bone are countless. So I invite you as a patient or as a clinician to look at our information that we have online, look at our information we have on the website, metalfreeimplants.com and startsmilingdentalimplantcenters.com. And I urge you, if you have any questions, to please contact us, or if you would like to make an appointment to come in and see us for a consultation. We are the premier deliverer of zirconia dental implants in the entire Midwest. And I am one of the experts of how to do this procedure in the entire world. And I would very much like to meet with you and to have a consultation with you and go over all the benefits that we have with zirconia implants. So I hope you enjoy what we have on our website and the befores and afters and testimonials from patients. We're also going to have our publications available that patients can read this and see some of the techniques that I pioneered, but also how we're now incorporating those techniques into using zirconia implants for delivery mechanisms. So I thank you for your time, and I hope that I see you soon, and I hope that I get the opportunity to discuss this procedure with you.